What is male infertility? Infertility is a problem with your reproductive system that stops you from impregnating a female. It can affect a man, a woman, or both. Male infertility means that a man has a problem with his reproductive system. It means you cannot start a pregnancy with your female partner. Infertility is defined clinically in women and men who cannot achieve pregnancy after 1 year of having intercourse without using birth control, and in women who have 2 or more failed pregnancies. After all, the necessity of reproduction is one of the few things on which both Darwin and the Bible agree. Studies suggest that after 1 year of having unprotected sex, 15% of couples are unable to conceive, and after 2 years, 10% of couples still have not had a successful pregnancy. In couples younger than age 30 who are generally healthy, 20% to 37% are able to conceive in the first 3 months. Infertility is a common problem for males. Conception is a complicated process and there are many obstacles. Fortunately, if you have infertility issues, that don't automatically mean that you won't be able to have your own child with your partner. There are treatments and procedures that can increase the chances of conception. Infertility is a common issue, with more than 5 million couples in the United States dealing with this problem. Infertility affects 1 in every 6 couples who are trying to conceive. In at least half of all cases of infertility, a male factor is a major or contributing cause. This means that about 10% of all males in the United States who are attempting to conceive suffer from infertility. Is it easy to conceive? Sperm are made in the testicles. They're then stored inside yards of plumbing called the epididymis, which lies on top of each testicle. Sperm are nourished by semen, which is made by glands along the way. When the magic moment arrives, about 150 million sperm are ejaculated in a half teaspoon of semen through the penis. Women ovulate, send an egg down into the uterus, once a month. This happens about 14 days after menstruation. Sex any time in the 5 days before ovulation can create a pregnancy. Sex any other time, even the next day after ovulation, will not result in conception. Couples are advised to seek fertility evaluations if they are unable to conceive after 12 months of unprotected intercourse. About 85% of couples will have had a pregnancy by that point. If they are over 30, they should seek evaluation after 6 months. This whole process hinges on there being proper levels of testosterone and other hormones as well as correct signaling from the nervous system. Conception. Conception is a complicated process that depends on many factors. The production of healthy sperm by the male and healthy eggs by the female. Unblocked fallopian tubes that allow the sperm to reach the egg. The sperm's ability to fertilize the egg when they meet. The ability of the fertilized egg, embryo, to become implanted in the female's uterus. Good embryo quality. Finally, for the pregnancy to continue to full term, the embryo must be healthy and the female's hormonal environment adequate for its development. When just one of these factors is impaired, infertility can happen. Which males are more likely to have infertility? Some males are more likely than others to experience infertility. You might be more likely if you have overweight or obesity, you're age 40 or older, you've been exposed to radiation, you've been exposed to environmental toxins including lead, calcium, pesticides or mercury, you use tobacco, marijuana or alcohol, you're taking some medications including cyproterone, flutamide, spironolactone, bicalutamide, cimetidine or ketoconazole. You're around heat that raises the temperature of your testes. Those who frequently use a sauna, hot tub or wheelchair might experience this. You have a history of undescended testicles. You have a history of varicocele, which are widened veins in your scrotum. You've been exposed to testosterone. Some males need injections, implants or topical gel for low testosterone. Many different medical conditions and other factors can contribute to fertility problems. An individual case may have a single cause, several causes, or, in some cases, no identifiable cause. Overall, 1/3 of infertility cases are caused by male reproductive issues. 1/3 by female reproductive issues. and 1/3 by both male and female reproductive issues or by unknown factors. What causes male infertility? Many biological and environmental factors can impact your fertility. Possibilities include azoospermia. Your infertility can be related to your inability to produce sperm cells. Oligospermia, the production of low or poor quality sperm. Genetic diseases, examples include Klinefelter syndrome, myotonic dystrophy, microdeletion and more. Malformed sperm, sperm that cannot live long enough to fertilize the egg. Some medical conditions, examples include diabetes, some autoimmune disorders, cystic fibrosis and some infections. Some medications and supplements. Variocycles, this is a condition where the veins on your testicles are larger than normal, causing them to overheat, which can affect the shape or number of your sperm. Cancer treatments, chemotherapy, radiation or a surgery that removes the testicles, one or both. Unhealthy habits, substance use, including alcohol, smoking and drugs. Trauma to your testes. Hormonal disorders, disorders that affect your hypothalamus or pituitary glands can affect your infertility. Sometimes, making sperm isn't the problem. The problem is getting the sperm where they need to go. Men with this type of male infertility have normal sperm in the testicles. But the sperm in the semen are either abnormal, very low in number, or not there at all. Causes of this kind of infertility include retrograde ejaculation. In this condition, semen ejaculates backwards into the bladder instead of out the penis. Usually previous surgery is the cause. Absence of the main sperm pipeline known as the vas deferens. This condition is a genetic problem. Obstruction. An obstruction can occur anywhere in the plumbing between the testicles and the penis. Anti-sperm antibodies. Antibodies can abnormally attack a man's own sperm on their way to the egg. Up to 25% of infertile men have idiopathic infertility. That means they have abnormal or low sperm counts for no identifiable reason. Who is at risk for male infertility? You may be more likely to have male infertility if you have had past inflammation of the prostate or past genital infections, injury to or twisting, torsion, of the testicles, early or late puberty, exposure of the genitals to high temperatures, hernia repair, undescended testicles. You may also be at risk if you take certain prescription medicines. These include medicines for ulcers, psoriasis, depression, and high blood pressure. What are the symptoms of male infertility? The infertility itself is the symptom. However, it's much more difficult to describe the negative psychological and emotional symptoms infertility has on a couple who wants to have children. Many times, conceiving a child becomes the total focus of their lives. Feelings of depression, loss, grief, inadequacy and failure are common in males as well as females seeking pregnancy. How is male infertility evaluated and diagnosed? Diagnosis begins with a complete physical examination to determine your general state of health and identify any physical problems that may impact your fertility. Your healthcare provider may also interview both you and your partner about your sexual habits. If the physical examination and history don't indicate any reason for your inability to conceive, the next step may be to conduct testing to identify the cause of infertility. What tests are done? First, your healthcare provider may do a semen analysis. It determines the following: sperm volume, amount of sperm per ejaculate; pH, a measurement of acidity or basicity; sperm concentration, number of sperm per millimeter of semen; total sperm count, number of sperm in your whole ejaculate; velocity, how fast your sperm travels; linearity, how straight your sperm moves; morphology, size and shape of your sperm; viscosity, how fast your semen liquefies. Next, your healthcare provider may do a detailed sperm analysis, which examines your sperm's viability, or ability to survive; morphology, or quality and shape; motility, your sperm's ability to move to the egg and fertilize it. Other possible tests include leukocytospermia quantitation/ENS test, Kruger's strict morphology classification, WHO morphology for sperm assessment, special staining for a zoospermic specimen, semen biochemistry fructose test, sperm antibody tests, direct and indirect immunobed, reactive oxygen species, sperm DNA assessment, physical examination. A thorough physical exam can detect varicocele and give clues to hormone problems. This should ideally be performed by a urologist. Hormone evaluation. Testosterone and multiple hormones made in the brain control sperm production. However, hormones are not the main problem in 97% of infertile men. Testicular biopsy. This is done for men with very low or no sperm in their semen. A needle biopsy of the testicle can show whether a man is making healthy sperm. If abundant good sperm are found in the testicle, there's likely a blockage somewhere. Genetic testing. Genetic tests can identify specific obstacles to fertility and problems with sperm. Experts differ as to when genetic tests should be done. Which healthcare providers diagnose male infertility? Ask your primary healthcare provider to refer you to a urologist who specializes in male infertility. You may also work with a reproductive endocrinologist. How is male infertility treated? With modern technology and methods, the number of treatment options for male infertility has expanded. Depending on the cause of infertility, treatments may include medications, hormone therapy to increase the number of sperm, lifestyle changes. Maintain a body weight that's healthy for you. Stop drinking. Stop using marijuana. Stop any recreational drug use. Vasectomy reversal. This common procedure is an outpatient surgery. The surgeon reconnects your vas deferens, which is the tube in the scrotum through which your sperm passes. Viewing the vas deferens through a high-power surgical microscope, the surgeon carefully sews the ends back together. Vasoepididymostomy. Blockages in your vas deferens are repaired with a similar technique. Your vas deferens is surgically split, the blockage is removed and the ends of the tube are reconnected. When the original vasectomy was performed many years previously, an additional blockage may have formed in the epididymis, the coiled tube that lies against your testicle where sperm cells mature. Blockage at the epididymis also can occur due to infection or injury. Whatever the cause, your surgeon will fix the problem by bypassing the blockage in the epididymis. Sperm retrieval. In some severe cases, a biopsy of the testicle is required to find sperm. Other, 1. Intracytoplasmic sperm injection. Artificial techniques of reproduction have advanced to the point where single sperm can be physically injected into an egg. This procedure, called intracytoplasmic sperm injection, ICSI, has dramatically changed the treatment available for even the most severe male factor infertility. Because of this technique, 90% of all infertile males have the potential to conceive their own genetic child. 2. In vitro fertilization. For some couples dealing with male infertility, in vitro fertilization, IVF, is the treatment of choice. During the IVF process, the ovaries are stimulated with injectable fertility medications to cause multiple eggs to mature. When the eggs are ready, they are collected in a minor procedure. Fertilization is accomplished by exposing the eggs to sperm in a culture dish, or by directly injecting a single sperm into each mature egg, a process called intracytoplasmic sperm injection. After fertilization, embryo development is monitored over the next 3 to 5 days. And 2 to 3 embryos are then placed into the uterus by way of a small catheter inserted through the cervix. What's the outlook for males with infertility? Just because you have issues with infertility, that doesn't mean you'll never be able to have your own child. There are treatment options. If you work together with your partner and a urologist, you can increase your chances of conception. Can male infertility go away on its own? Male infertility requires treatment in most cases. Complications. Complications are typically due to psychological distress, stress, and issues with the marital relationship. Evaluation and treatment of infertility can be expensive. It could be frustrating since there are no guarantees of success and insurance does not typically cover this condition. There is also the chance for complications related to any of the surgical procedures. Most problems with reproduction do not affect their ability to produce male hormones, their sexual function, or their maleness. But even if things look bleak, the experts still have some hopeful advice. Keep trying. As many as 25 to 35% of infertile couples will go on to eventually have a child without any treatment. By using some combination of arts for several months, most couples can expect a pregnancy between 40 to 50% of the time.